Let's do a call to order. This is study session of February 16, 2021. It's now 5:05. We'll begin roll call. Please, Mary.
President Lay,
Here.
Vice President Herrera,
Here.
Clerk Chavez,
Here.
Member Cortese,
Here.
Member Doe.
Here.
Is Student
All right.
Board Rep Bruce Wynn present?
Here.
Thank you.
Awesome. Welcome everyone for board study session. And we move to agenda item 2.01. So members of the public, please submit your public comment online by accessing the form on the district homepage at www.esuhsd.org. Please limit your written comments to no more than 1,000 characters in length. Public comments submitted online will be read into the record. You may also raise your virtual hand in Zoom to request to speak. You will have 2 minutes to speak. Please note, all meetings are recorded. All regular and special meetings of the Board of Trustees and Board Study Session are streamlined on meeting nights and also available for viewing the day after the meeting by accessing the district YouTube channel listed on the district webpage at www.esuhsd.org under the quick link section. The board is not able to respond to items that are not on the agenda or any personnel issues. Their comments will be read into the record and will be directed to the superintendent and or the appropriate staff member for response. Interpretation of this meeting in Spanish and Vietnamese can be heard by accessing the link and following the instructions shown on the agenda and the district website. So we move to adoption of agenda 3.01. The superintendent and the board members may request that item be removed from the agenda for consideration and or carried to a future board meeting for consideration and or action. I saw only one item, so I don't think we gonna remove any item. So let's move to 4.01, presentation and or discussion regarding budget and brainstorming ideas for savings and FTE reduction focus group. Mr. Fang, please take it away.
So Madam President, may I suggest, since we normally have these focus groups in the boardroom and everyone has their name tags, we usually go around and do introductions. May I suggest that we do that this evening?
Yes, please. We can start with me, Von Lay, Board President.
Manuel Herrera, Board Vice President.
Lorena Chavez, Clerk.
Patty Cortese, board member.
Brian Doe, board member.
Omar?
Omar Gutierrez, Assistant Director of IT.
Mary?
Mary Gillen, Executive Assistant to the Superintendent Board.
Randy?
Randy Phelps, Chief Technology Officer.
Brandon?
Brandon Rosado, ESTA Bargaining Chair.
Chris?
Chris Jew, Associate Superintendent of Business.
Glenn?
Glenn Vandersee, Associate Superintendent of Human Resources, and I'll also be reading out any written public comment.
Rogelio?
Hugh Ruiz, the district's outside legal counsel.
William?
William Lasso.
William Barnes, President of the San Jose Federation of Teachers.
Teresa?
Teresa Marquez, Associate Superintendent for Educational Services.
Bjorn? Mr. Berg?
Did that not go? Bjorn Berg, Independence High School Principal. Getting the audio connected.
Thank you. Brenda?
Hi, my name is Brenda Serrano, and I am a parent at Mount Pleasant High School.
Bruce? Bruce Nguyen, Student Board Representative. Carter?
Carter French, parent.
Jack?
Hey, I just wanted to say what's up to everybody and thank you for being here on what's supposed to be our vacation week. And my name is Jack Hamner and I'm the president of Eastside Teachers Association.
Paula.
Hi, my name is Paula Escobar. I'm a member of the Student Governing Board and student member on the Budget Advisory Committee.
Sylvia.
I'm Sylvia Pelayo, Director of Finance here at Eastside.
Thomas.
Thomas Brittendahl, teacher and ESTA PAC chair.
Vito.
Good evening, everyone. Vito Chiala, principal at Overfelt High School and representing ACES.
And Mr. Barnes, I think you got cut off. If you would introduce yourself, please.
Good evening, everyone. Bill Barnes, co-president of the San Jose Federation of Teachers, teacher at Independence Adult Education Center.
And did anyone see, did I miss anyone?
You miss yourself.
Oh, Chris Funk, superintendent. Thank you, Madam President.
Okay.
All right, I'm going to stop sharing because the primary presentation is going to be from our CBO, Chris Jew, and it'll be easier for him to do it in from his desktop.
Madam President,
Yes.
could I also suggest, since not every
Patty, I cannot hear you.
I didn't hear that either.
I cannot hear you, Patty.
Can you
Hear me.
suggest that? And that's where I heard. Can you suggest?
Yeah.
How about now?
Yes.
Yes.
It's okay?
Yes.
Okay. I mean, if we were sitting in person, we would be literally around the table and everybody could see each other.
Right.
And not everybody who's here with us tonight has participated in this process before, but I just think it's useful to remind everybody that if you are here on the panel, you are free to participate in the conversation. You're not limited to 3 minutes of public speaking. You're free to ask questions, you know, like that. I don't know, Madam President, if you want to add anything to those instructions. I just want to make sure everybody knows they're here as a full participant and not, you know, necessarily as an observer or
Right.
you're welcome to ask questions, make comments.
But
all
I
that.
think it's appreciate board member Patty Cortese for your suggestions. I think that we want to ask the panelists of the board study session first, then we open up for a second, because I don't see, or maybe if Chris Funk or Glenn Vanderzee can help me, whoever want to raise their hand, and then we're gonna take the panelists comments, then we open for the next observer, because I don't know who's the observer.
Yeah, and right now, Madam President, we only have 4 attendees. So if they raise their hand, we'll be able to call on them. Usually the study sessions, the board has always allowed just that interaction with the audience and as well as the focus group.
And Madam President, I will make you aware if anybody enters written comment as the conversation is occurring.
All right, appreciate that. Okay, so thank you, Patty. Yeah, let's move on.
Okay, good evening. Can everyone see the slide on the screen here, the budget study session slide?
Yes.
All right. Okay, perfect. Okay, so welcome everybody. Thank you. And to kind of piggyback on what the board president was saying, and feel free to interrupt me as questions come up. I will make sure to kind of stop between each major section to entertain questions or get a chance for people to ask clarifying questions before moving on to the next. So there's a lot of information tonight. We could certainly spend an entire evening just talking about, say, special education or student nutrition services, but tonight we're going to kind of give you a little bit of a deeper dive into what we've given you in the past as far as the budget and particular areas. So let's start with what the plan for tonight is. So we're going to go and take a deeper dive into some of the topic areas. We're going to talk a little bit about what the status of the current ending fund balance, and what we'll talk about tonight is not talk about what we're projecting for next year, but we'll also give you an opportunity to take a look at what has been the last 5 years or what has been the trend in all these particular areas. So we'll start off with the fund balance. We'll go into deficit spending, and then we'll start honing down into salary projections, since that's the largest, I guess, piece of our total budget is all of our salary costs. Drill down a little bit on things like pension costs, health insurance, and then some of the general operating expenses, utility costs, insurance, and then get into the larger areas, the contributions from the general fund. So that's the plan for this evening. And then again, welcome to entertain questions and answers as we go through.
Mr.
What's on
Ju?
the right-hand side? Yes,
Mr.
sir.
Ju? I'm like a broken record, but I think it bears repeating on an ongoing basis that what we're going to hear tonight is based on what we know as of now, and that there's a fluidity and even a volatility in these numbers. And things will be different even by the March second interim report, and they'll certainly be different by the June adoption of the budget, and they'll continue to change. So, our engagement today and clarifications and everything is based on a beginning assumption that it will change, and sometimes in very significant ways. We're just working with what we know as of now. That's it.
No, definitely. Thank you, Board Member Herrera. This is one of those things that, as long as people know that we're always going to give everyone the most up-to-date information we have as of this moment in time, and that between now and even May, or even by June when we adopt our budget, it's very likely that many of these things that we're even talking about tonight are going to change. Okay, so things can go up or down. Things obviously can change a year from now too as well, because we're going to start talking about things not just for next year, but also things that impact the budget further down the road. So
And
with all
Chris,
that said and done,
Yeah, Chris, let me just add, I should have done this when we adopted the budget, to remind the board and the focus group that tonight we actually have a hard finish. So we're scheduled to go 2.5 hours tonight. We have a lot of information. We think we can get through the 2.5 hours, but if there's parts of this presentation that we're unable to get through, or certainly I'm sure there'll be follow-up questions, and I'm sure the board will entertain a second round of focus groups in the near future. But we do have a hard stop time tonight of 7:30.
What makes it a hard stop?
Our president has to leave. That's why we started earlier and changed the time from 6 to 5 o'clock start time.
Okay, thank you.
Thank you.
okay, well, okay, I got my marching orders. Okay, so I'll go through. So just quickly here, just to kind of summarize what we're talking about, we're obviously getting ready to start putting together a district budget for adoption for the coming 21-22 school year. And what you see on this slide here are the many factors that go into building the budget. And again, it's not looking at the budget in a one-year perspective, but looking at the budget over 3 years. But tonight we're just going to focus on what this green bubble here, the expenditure. So tonight's focus is just going to be on the expenditure part of the district's budget. So first off, we're going to start off looking at the history of our ending fund balance. So I'll help orient everyone to the graph here. So we have down here the years. So we go back tonight. Everything is going back as far as the 2015-16 school year, and showing the current year, 2021. It's still a projected number as of now, since we're just over halfway through the school year. And then some of the slides will even show what we're projecting for next year. But I think really the takeaway from here is that you can see what has been the trend as far as our ending fund balance. Our ending fund balance since 2015-16 has been on the decline. I did a quick math calculation here. Our ending fund balance has dropped by about 28, almost 29% since 2015. But one of the things we do have to take into account what has happened since that period of time. Since 2015-16, We've had several pay raises. If you recall, we've also restored class size. So those are some of the larger things that I took note of to say that were the things that were contributing to this decline of our ending fund balance. So 2018, our ending fund balance dropped to roughly $40 million here. The ending fund balance, as you see here for 1920, actually went up. Interesting. But I think people need to also take into account tonight a lot of the stuff that we're going to talk about tonight in terms of the trend. You'll see that this last year, the 1920 school year, going into this current pandemic crisis, has really made some changes to some of the trends that we've had experience with much of our budget. So as you can see here for 2018-19, if we would have had a normal school year, it would have been very likely that we would have continued on this path of further eroding into our ending fund balance. However, because of the pandemic and not having technically a full school year and technically having a fully expended budget last year, we saved money. So that money that we didn't spend last year increased our ending fund balance. So you can see here that our ending fund balance actually improved in consideration, but again, it was under the environment of the COVID-19. For the current year 2021, right now, without any major changes to the budget, we're projecting our fund balance to increase. But based on our current multi-year projections, we're projecting our fund balance then to decline in 21-22. Any questions before I move on? The next slide will actually talk about the deficits. Now, this was just really talking about the ending fund balance.
Chris Chu,
yes.
How did you project it from 2021, 35 million, go down like 10 million on 21-22? It's a really big gap and a big number compared with the 19 and 20, right?
Mm-hmm. No, it's a good question. It's a great question. So the reason why the ending fund balance drops from almost the combined, now this is the combined ending fund balance of about almost short of $50 million. The reason why it drops from $50 million down to closer to $37 million is because of what we're projecting next year's budget or cost increases to be. And that's really to the heart of tonight's conversation. We're going to go through each one of those areas that are contributing to why the fund balance is projected to decline from up here down to here.
Okay.
So great question, and it's perfect timing as we go into the specific areas.
Thank you. Go ahead.
I'm sorry, Chris, Brandon has his hand up.
Oh, yeah, just on that last slide, Chris, just a clarification, because is the blue portion, is the unrestricted ending balance, but our total,
the blue
all of those numbers added up?
Yep, all three of these total up is the entire general fund. The blue part is just the unrestricted portion.
The unrestricted ending balance. Okay, so but the total, so that, are you saying that the reserve is already set aside? So that actually is unrestricted as well in the blue part, technically.
So the green, the green part on the bottom represents the district's minimum 3% reserve.
But okay, but that is also
the orange portion. Well, unrestricted from the standpoint, it's part of the general fund unrestricted balance, but we obviously can't spend down into it.
Okay, I understand that, Chris. I'm just saying when I'm looking, or someone in the audience is looking at this, it looks like the unrestricted balance is 35 million, but it's really 35 million plus 8 or 9 million, right? And 25 plus 8 or 9 million, and then the restricted is restricted, but that's also, you know, set aside for something else. So I just want to clarify your graph, Because if you look at your bar is almost up to 50 million in 2021 projected, right? And it's well almost 40 million in 21-22 projected. So, you know, I just want to get the total numbers there. So it's all three of those numbers added up is the total height of the bar. So clarification on your graph really is all I'm asking for.
Yeah. Thank you. Okay, the next slide just kind of gets into the questions of the level of deficit spending, what particular years has the district been deficit spending. So this goes back to 2012-13, just to kind of orient you to the graph here, or slide here. We are showing what was projected at all of these different reporting periods. So at the adopted budget, there was a projected either a deficit or a surplus. When the first interim report was done, there was then a revision to reflect whatever the current projected deficit or surplus was. And so all the way through the different reporting periods to the end of the year, the unaudited actuals, as we refer to, is the final numbers that we closed our fiscal year on. So let's go as an example, 2014-15, we projected a deficit of about $13 million. During the course of the year, the level of deficit spending was adjusted as revenues and expenditure assumptions were updated. But by the end of the year, we actually ended up deficit spending in 2014-15 by about $6.2 million. The following year, there was a lot of incoming revenues for the district at that time. And that year, we actually ended the year with a surplus. In 15-16, we ended the year with a 9.9 additional surplus. But then when you look at the following years until the present time, 16-17 through 2018-19, we did have back to back, so 3 consecutive years where we were spending down our ending fund balance to the tune of about $3 to $4 million here, as you can see on the slide. Again, as I showed you on that previous slide, bringing down the ending fund balance to where it is today. For 19-20, just yes.
Well, I hope I'm not interrupting prematurely here, but one key element in my understanding this continues to be that Jerry Brown pumped a lot of one-time funds that kept contributing to our ending balances and allowing us to address the deficit situation so that we never were actually in the red because we had one-time funds bulking up as Jerry Brown kept following that strategy with new revenues that were showing up. And then that leveled out and, you know, here we are.
Mm-hmm. Yeah, well, I mean, during that time, the one-time dollars were spent on some one-time things, and we were also leveraging some of those one-time dollars to help take care of some of our ongoing needs. And so, yeah, over time, it starts to catch up to us. But the last thing I want to point out is as far as the ending of last year. So the fact that we ended last year the way we did end up with a surplus of about $2.6 million. That as far as our ending fund balance, and that went back into this year's starting balance. So right now we obviously aren't at the end of our fiscal year yet. So as of first interim, we were projecting our ending fund balance for this coming year to be about $6.6 million more in terms of a surplus. But I think, but as I mentioned, this number is going to change between now and when we close the books. Any questions about just the historical perspective, or just the tracking of the years of the projections that we've had as far as deficits or surplus before I move on? Okay. All right. So the next section I'm going to spend time talking about is salaries, but more specifically salary projections. Salary projections, as I said earlier, represents the largest part of our budget. So it's all of our personnel costs. And so calculating or forecasting or projecting our salary costs for the coming year, as well as the multi-year, plays an important part in terms of making sure that we set aside or we account for those future dollars. And so tonight I wanted to kind of talk about the methodology for which we calculate our salary projections for the coming year, as well as for the outer years, because our budget is not just a one-year budget, it's a 3-year budget. And so for purposes of the upcoming year's adopted budget, what would typically happen is that when we get ready to start building the budget for next year, so I'm now talking about the 21-22 school year, what would typically happen is that in our financial system, we would go in and identify where every current employee is placed. And I'll talk about placement here because that's really behind the scenes, the methodology of calculating future salaries is where every employee in particular, whether I'm a certificate employee, a member of ESTA, or a classified employee, a member of CSEA, as an employee, the district has placed me on a particular salary schedule. And depending upon where I'm on that salary schedule determines what my salary will be for the coming year and for the future years. And that's really the methodology here behind projecting salaries. And then the other important piece in terms of salary projections is also accounting for all positions, right? We have, I don't know what, maybe between certificate and classified, we have maybe just under 2,000 positions or 2,000 FTE positions. The majority of them are filled, but we do have some that maybe aren't currently filled. But from a budgetary standpoint, we have to budget as though every position's filled or we have every intention on filling those positions. And so that's really, really the most basic way I could explain how we approach projecting salary costs. But one of the things I did want to just mention here is you've seen that we've used or written in our budget assumptions that the district uses a percentage of 1.5% for certificated and 2% for classified. So those two percentage numbers that the district uses for calculating, in this case, the costs of step and column on the salary schedules are, again, these are assumptions. These are assumptions that are suggested in this case by school services. And I would say most every school district uses this kind of as their basic or base funding for salary projection assumptions, but more especially for multi-year projections. It's to really take into account over a longer period of time. When you take into account, you have people that retire or people that leave your district, there's a certain level of attrition, and that at the same time, people that are coming off the salary schedule that are placed higher on the salary schedule with employees that are paid at a lower salary schedule, that these percentages are used to take that into consideration. But this first methodology I was referring to really is also what we use for building our adopted budget, where we actually take a look and see where everyone is placed. And the presumption would be is that if I'm on, say, step one of the salary schedule, the presumption is next year, or as long as I've completed a full school year, I'm going to move up one step into the next pay schedule. And so depending upon the pay schedule and whether or not there's an increase or not, that is really the determining factor for salary projections. And then what typically will happen is that during first and second interim, when we update, we'll fine tune those numbers, because imagine this, that during the course of the year, course of the year, if I'm a teacher and I'm bringing in additional units, I may be able to turn those units in to move me up on the salary schedule. And so those kind of changes as well happen during the year. And then also too, we do take into account savings for positions that are unfilled at the beginning of the year, and as those positions are filled, we account for those. But as positions remain unfilled by the time we end the year, we do eventually take all those savings into account. So let's kind of dig into some of the behind the scenes as far as salary projections go. I mentioned about salary schedules and placement. So here is just a snapshot, or what I would call a scattergram of our current ESTA membership. All those employees that are currently on the 182-day salary schedule. And so as you can see here from the graph, there's 4 different salary areas. Actually, the salary schedule is broken down this way. For employees who just have a bachelor's art degree, they will fall within this salary range. If I have a bachelor's degree plus 30 units, I fall into this salary range. And then if I have a bachelor's degree and 65 more units, I fall on this salary area. And then each line here represents a step. So in this last range here, there are actually 32 steps on the salary schedule. So as you can see here, as it tells you how many people are at any particular step and within each range. I'll talk a little bit about why I have some in black and some in yellow in just a few minutes here, but this really is just kind of, again, a snapshot of everyone that where they are currently placed on the salary schedule for teachers on the 182-day schedule. Here are the placement of ESTA members on their 192-day schedule. And so let's get here into the details of how we go about calculating the salary projections for the coming year. So as I mentioned, when you look at the salary schedule, so here's an example of the salary schedule on the left-hand side here, where, as I mentioned, there are 32 steps on the salary schedule. Depending upon how many units I have, I'm going to be placed in one of these cells here. And so for calculating the step increase, as you can see here, going from one step to the next, in most cases here, may represent a salary increase. So let me show you as an example. Column D here, if I am currently on step 1, I am currently making $65,531 a year. If I fulfill my requirement for working a full year, I am going to be moved up to step 2 the following year, where my annual salary will increase to $66,417. So hopefully everyone if that makes sense to everybody. So when you follow along on the salary schedule, each particular step may have a corresponding salary increase. But there are a couple steps here on the current salary schedule where there aren't particular salary increases. When you get to step 12 on the salary schedule, if you are on range D here, your next salary increase would not happen until you reach step 16. So there is a 3-year gap here between steps where you would see a step increase. And obviously this is set aside. I mean, this is just step increase. This doesn't represent any salary increases that are negotiated as far as increases to the base salary.
Chris, before you move on, Jack has a question.
Yeah, Jack.
Yeah, hey, I just had a question about the this step and column stuff, because I understand, with the budget and second and third year projections, But I guess my question is, once October 1st rolls around, everybody that has to submit units to move over on the salary schedule has to have those completed. And by then we should have hopefully hired most of our open positions. So don't we normally calculate what the actual step and column increase, if there even is an increase, after some point and after October? Like, do we calculate that? Because I understand a projection, but
Yeah.
I think historically,
Yeah, we do.
what an actual number would be.
No, we do. So let's use this year as an example. So if I'm a teacher, again, if I had to turn in my units by October, the district has calculated in its current budget. So yes, as a first interim, we are actually saying, okay, Jack, you have X amount of units. You turned in, say, 10 more, and that moved you on to the next salary schedule. We will have taken that into account this year. So the employee would be paid obviously on their new step and column, but then the budget would be reflected of that as a first interim. So we do take into account in real time those changes to the budget. But what I'm talking about projection is that right now, I wouldn't necessarily know that you were planning to turn in additional units next year. I wouldn't necessarily know whether or not you would be moving from one column to the next until you actually turn in the units. But what I'm sharing with everyone tonight is just with the presumption that just after 1 year of a completion of service with the district, an employee moves up on the salary schedule one increment at a time.
Yeah, I guess what I'm really asking for is, do we ever calculate the actual step and column increase or decrease? Like, we should have that data, right? Don't we have that? Because like I said, once October rolls around, we know those numbers. We know how many people retired and we know how many people we hired and how many positions are open. So we should have almost an actual versus a projected step and column increase.
It sounded like he said that by the first interim in December, that all gets rolled into actual figures versus
for the current year.
I get that, but I guess like there isn't a spot where we can go back and look at that and say, oh, this is what it really was for step and column. Like, and unless I'm not able to see that buried in there, because there's so many numbers on those interim reports. Like, I'm just curious as to where, what this year's step and column was. We had a lot of people retire. We obviously had to hire a lot of people, but at less salaries. So, what was that step and column? I mean, I don't believe that was in the first interim unless I missed it. I wouldn't know where to find it if that's the case.
Okay, well, we can follow up after and get you the exact number for this year's step increase. But again, tonight I was just focusing on what we're projecting for next year, but we certainly can go back and pull the number for this year's step increase, certainly. So the projection for next year, again, presuming right now everyone comes back next year, obviously I'm not taking into account right now anyone that's retiring or anyone that's hired into the salary schedule, but based on where everyone is currently placed this year, forecasting where they will be next year, multiply that by the dollar increase of their particular salary. When you multiply all that out for a 10-month employee, the projected step increase totals close to $2.2 million here in terms of additional cost. And this is just salary. This isn't including the pension costs, the other statutory benefit costs. This is just the salary change compared to the prior placement on the salary schedule. And so one last thing on here, I just took an average of all the step increases here. So as I said, there are some steps on the salary schedule that don't have an increase. But so when you take into all those steps that don't have increases with all the steps that do have increases, the average step increase is 2.62%. All right, I will kind of pick up the paces a little bit. I did the same thing for the employees on the 192-day schedule. That projection comes out to an additional $60,000 714. And so those numbers, I will come back and recap it, so you don't have to memorize that number right now. I've now we're going to switch to the CSEA side. So I've done the same thing for CSEA. CSEA, they have 3 different salary schedules. They have one for 10-month salary positions, and these are all those positions. They have 11-month salary positions, so they have a schedule for that. And then they also then have 12-month positions or a corresponding 12-month salary schedule. So these are similarly all the same, all of their placements. Their salary schedule is based on several different ranges. However, they only have a total of 6 steps. But in addition to just their 6 steps, they here are the salary schedules, as I mentioned, several different ranges, just 6 steps on the salary schedule, but beyond their step 6 on the salary schedule, they have a longevity schedule, and then that's on this page here. So I'll use as an example. Once I'm with the district by my 8th year in the district, and that presumes that you are already have been on step 6. So starting with my 8th year with the district, I would be entitled to receive an additional longevity step. And so in this case, if I'm a 10-month employee, I'm receiving an additional $107 a month for 10 months. And so that's basically how the classified salary schedule works. And so similarly, like I did with the certificated staffing projections, I did the same thing for CSEA. So depending upon where everyone was placed on the salary schedule, I advanced them up a step. And for those employees who are already on step 6 or higher and in the longevity, what you see here is every 2 years. So the 8th year, the 10th year, the 12th year, the 14th year, every 2 years, and employees are moving up on the longevity step. So since I didn't have time to get into the specifics on where every CSEA member was on the longevity schedule, I took everyone that was in the longevity schedule and just said, well, let's just presume right now half of them moved up into the next longevity step next year to factor in what the longevity increase is. The longevity increase is, the difference is roughly about $50 more per month. So when I calculate that out based on the number of people, this is what I come up with as far as longevity increase. So for projection purposes, if I'm a 10-month employee, the projected cost increase is about $202,000 for all those employees on the 10-month salary schedule, $16,000 for the 11-month salary schedule, and then $321,000 projected for all those on the 12-month salary schedule. So the combined total, as far as for budgeting purposes, for a step increase for CSEA would be a little bit more than $540,000 to the district budget. And again, this is just salary; it's not including statutory benefits. And so here's kind of the recap of all those numbers. So on this chart here, I was just kind of charting again what I was projecting all the salary increases, presuming everyone moved up a step, that moved into a step that had a corresponding increase. So all of that totaled $2.9 million. The statutory benefit costs, and again, to remind everyone, these are like the STRS, the PERS, the workers' comp, Social Security, Medicare, all of those payroll-related taxes are add-ons to the salary. So that total almost $660,000. So those two numbers added together represent a value of about $3.7 million of a potential salary increase or step increase for this coming school year budget. I did add in AFT, as you can see here. AFT here also has a salary schedule. They move up, although their hourly rates. And each year the teachers' hours may vary. I calculated it just based on this year's current salaries, and their average pay increase on their steps are about 2.8%. So I calculated their portion to be about almost $82,000. So I come up with $3.7 million. But if you recall on that second slide, that first slide here, we had projected step increase based on that 1.5 and 2%, totaling almost $3.2 million. So a little bit of a variance between that initial number and this number here that I am now calculating. One change is obviously the AFT number, but again, as I mentioned, these are just two different methodologies. The methodology I used was just taking where everyone actually is on the salary schedule and advancing them, whereas our initial projection here that we use for our multi-year, kind of further out in the second and third year assumptions, is we just take the current total salary, multiply that portion, the certificated salary portion, by 1.5%, and then taking that portion of the classified salaries and multiplying that by 2% to come up with this number here. So the only difference between my number and the number that we were talking last time was about $500,000. Any questions before we move on? So this is the completion of just that part of the salary and benefits part, the salary part.
So so each year the number will slightly change, right? Or whatever you projected, for this is the 2021 to a 21-22, the number could be changed. Am I correct?
If I understand your question, so from one year to the next,
yes,
the number is going to change, and that is absolutely correct. The number will change, but we have to take into consideration what assumptions, and right. So if we're assuming that, right, there aren't any layoffs and we have the same number of positions as compared to the year before, the salary changes from one year to the next are really reflective of changes on the salary schedule.
Right.
But if we decide to add positions or to lay off positions, that changes that number as well.
Right.
So
this is, yeah.
Oh, I'm sorry. Hopefully that answers your question.
Yeah, I can see that. My question also is, this is 2021-22. What you projected less than what is supposed to come out with the total cost for 21-22 from the slideshow.
Well, I mean, since again we're talking about budget assumptions, right? These numbers are going to continue to change. So
Okay.
today, based on where I'm showing you this one methodology of taking where everyone is as of today and moving them one step on the salary schedule, this is the number. This is the number I'm projecting now, $3.7 million. But when we actually, like Jack Hamner was asking, once everything is settled in, once everyone turns in their units, will the district be able to accurately calculate what that number? And the answer will be yes. This number here, we won't know what the true number will be. We won't know until the fall, once we know, how many people move on the salary schedule. But probably just importantly, we don't know who will retire at the end of this year and who new we will rehire in their place and where they will be on the salary schedule. We won't know that obviously until the fall. But this number here just represents an assumption that if everyone that's employed today all returns next year. And if they move on the salary schedule, this is what the value of that increase would be.
Okay, thank you.
Chris, Thomas has his hand up,
Yes,
and then Brian.
yes, Thomas.
Hey, Chris. I know it was only probably the last week or so since we met, but have you had a chance to look at basically taking all of the, say, started like 2015, 2016, the total ESTA salary divided by total ESTA employees to get an average salary, and then do the same thing for the years leading up to the current year, and then subtract out any raises to see what that actual step and column increase has been, like a trend of it?
So I'm about 1/3 through that exercise. So actually the next two slides start off with what has been obviously the 5-year cost. So let me get to that part. So let's start with there.
Well,
Thomas.
but,
And then I know Brian had a question too.
Chris, Brian had his question too.
You mentioned that we
Yeah.
don't know who retired. Don't we usually know with reasonable amount of accuracy that those who are close to their retirement age, or is everyone have a different retirement time frame?
Oh, I think everyone's got their own. Obviously, everyone has their own retirement time frame. It depends on where they are in their career, how many years they may be been contributing toward their retirement. So there's I mean, I may not be the best person to explain what really the proper time to retire.
And Sylvia, do we not budget approximately 25 a year retirees?
Yes,
Except you don't know who they are.
correct.
Okay, fair enough.
Okay, the kind of leading into the question that Thomas is asking about. So the question here is, can we go back and look at the past and look at, where we were in terms of projecting and where we ended up in terms of actuals. And so here's just an example of just all certificate. Actually, this is ESTA as well as management. It's all certificated combined here. I apologize, we didn't separate it out that way on the slide here, but this shows how much we were budgeting at the adopted budget, and that represents this blue line here. And the green line here represent what was that final actual expenditure amount for those particular years. And so anywhere you see this gap here, obviously says that we budgeted more compared to what we actually expended. So very close when you look at the track here. 15, 16, what was budgeted at adoption was very close to what was the actual. For 16, 17, there was a gap. I'm going to say it was probably about $2.5, maybe $3 million difference in gap between what was budgeted and what was actual. And then 17, 18, a little bit of a gap. And then 18, 19, it actually flipped, where the district budgeted less in comparison to what was the actual that year. And then we're kind of trending back in the other direction, where the adopted budget is more than the actuals. And so going back to the question, can we go back and account for why there's a gap between the adopted budget and the actual amount? And so I went back to look at how many vacancies did we have, at least what I found in our system. I went back in our financial system just to see how many open vacant positions we had as of, and I picked May 1st. I picked May 1st of every school year back to 15, 16, because I wanted to capture how many positions that were really unfilled during the year. I wasn't at that time factoring in people who retired at the end of each of these school years, but I wanted to see just how many positions may have been vacant during that school year, to just kind of see if those positions, let's just assume those positions were unfilled the entire year, each one of these positions created savings, or maybe another way of saying it, all of these positions that were budgeted for in the adopted budget weren't filled, and those monies then became savings, or it didn't become an actual expenditure to the budget that year. So the fact that we had as many as 30 right here in 16-17 for certificated, we had about 37 vacant positions as of May 1st. But again, some of those positions could have been just there for 6 months. Some of them could have been vacant for 8 months. Some could have been vacant for 2 months. But as of May 1st, I just said, well, let's how many vacancies did we have to see if that is a large number. And I would venture to say right now, because of this large number here, a lot of that is does explain why there is this gap between what was budgeted at the adopted budget and what was expended at the end of the year. But then the question that Thomas Brittendale was asking about, going back and looking at the the salary cost increases for each of these years, and taking the number of FTEs and using that as the denominator to divide into this to calculate the differences in salaries from one year to the next. I haven't done that, Thomas, as I mentioned. I haven't gotten that far, but I will certainly do that for you after tonight. But this is really, I wanted to make sure that we provided some context in terms of the variances between what was in the adopted budget and where we actually ended the year. And so I did the same thing for classified. And so when you see for classified, it's a larger gap. The dollar amount may not be as much as certificated, but the gap does reflect a difference between what was adopted and what was the actuals. And so I did the same thing and went back to look at how many vacant CSEA positions or classified positions were as of May 1st of each of these years. And as you can see here, the range is anywhere from 40 to 50 over the span of time. And so those positions vary from paraeducator positions, custodial positions, bus driver positions, food service worker positions. So there's a lot of them. I have the details, but tonight I just wanted to highlight some numbers here for everybody. Any questions on this part here?
I think Jack raised the hand. Jack, please.
Jack?
I don't think so. If I did, it was unintentional.
Oh,
Sorry.
okay. All right.
Okay. All right. No problem. You can save it for next time. All right. All right. So the next part of this is talking about pension costs. So STRS and PERS, just to give everyone some context again. STRS is the State Teachers Retirement System. PERS is the Public Employees Retirement System. If I'm a certificate employee, I contribute, as well as the employer. I mean, the employer contributes for both, but the employees contribute as well into their corresponding retirement systems, and PERS is for all classified members. And so as you can see on the graph here, let's start with the table on the far right-hand side here. Dating back to 1314 is when the state made it then more the responsibility for the employers to pick up a larger share of the retirement costs. And so they've, since back 2013-14, have been increasing the employer contribution rates for both retirement systems to obviously deal with the need to fund the liability for both the PERS and STRS programs. And so as you can see here, STRS, at one point in time, the employer rate was as low as 8.25%. It is currently now, this year, at, let's see here, 16.15%. So it's literally almost doubled in the last 7 years. And for PERS, back in 13-14, the rate was just a little bit more than 11%. And today the rate is 20.7%. And that actually, the PERS rate is projected to go to 23% next year. And so for our purposes of tonight, we were trying to project what the cost increase for next year's PERS and STIRS increase. And so initially when we gave you the projection for 21-22, excuse me, for 21-22, we were calculating the projection just based on the rate increase, or in the case of STIRS, the STIRS rate decrease. So the STIRS rate decrease is projected to decrease, I believe, approximately 0.22 or 0.23%. And as I just mentioned just a moment ago, the CalPERS rate is projected to go up by 3%. So the rate is projected to go up. But obviously, the fact that the rate goes up, the actual cost to the district, or the total contribution cost, is a factor of the size of the payroll, or the amount of the salaries and benefits. So even though the decrease of 0.22% on the STIRS rate is a reduction in the rate, it just depends on how much or what the size of your payroll is, because let's just assume right now the payroll is exactly the same. So no step increases, no salary increases, but yet the rate changes. Then obviously you can do the simple multiplication of taking the total salary, multiply that by the decreased rate to calculate what would be the rate savings in that case. But because our payroll size is projected to increase, then the increase in the rate, the actual increase in the cost will change, not just because of the rate, but also based on the size of the payroll. So based on what we're projecting next year's salaries, both certificate and classified, those STIRS costs and PERS costs are represented here where I'm pointing my arrow. For 21-22, the STIRS cost is not quite $20.5 million. The PERS cost is about $7.8 million projected. Total cost is $28.3 million, which when you look at an annual increase, it represents about not quite $1.2 million increase compared to the year before. So this is the number here that I've updated on that first page that we looked at, and I'll show this number again at the very end of the slide presentation. So the rate increase or the cost increase?
The cost increase percentage projected?
So the cost increase is $1.2 million on what was originally a $27 million. So I'll just do I'll do a rough calculation for you, Manuel. So 1.2 million on 27,178,000 is about a 4.4% increase. So there's about a 4.4% increase in cost. No, given that there was still a 0.22% decrease in the rate for STIRS and a 3% rate increase on the PERS.
Thank you.
Okay. All right. Next topic, health benefits. So I'm showing you here what the last 6 years of what the district's total health benefit costs have been. The amounts have been gradually going up, but I do want to just talk a little bit about how our benefits programs are set up. Most of us may not be familiar with the terminology of fully insured medical plan versus a self-insured medical plan. So let me just kind of describe each one of them. So a fully insured medical plan is what we might typically find. So if I working in the private sector, or if I am self-employed, I may very well be purchasing a medical plan directly with, say, Kaiser. In this case, Kaiser is a self-insured plan where we pay them the premium. They provide the medical services. They fully insure all of your medical costs related to your plan that you buy from them. Whereas a self-insured plan, the way the self-insured plan works is that the employer is setting aside monies to pay for each employee's current as well as projected medical costs related to their current medical situation. And so monies that are set aside are to pay for actual costs, not like a fully insured plan where you're paying toward what would be an insurance plan to take care of any catastrophic injury or any routine medical visit. But with a self-insured plan, monies are set aside to pay the actual claims, the actual costs of the employee's medical expenses, whether it's a doctor's visit or whether there's a cost to be admitted to a hospital. And so those are basically the two different type of medical plans that we have. But when you start talking about what those costs are, for fully medical insured plans, a dollar spent on premium is a dollar cost to the district. But for self-insured, for the self-insured plan, for every dollar set aside for the employee's medical claim, if that medical claim obviously does not materialize, or maybe use an example, a particular employee was referred to a specialist to have a certain procedure, and say they didn't actually do that procedure. Well, that money actually did not get expended. So that money has been set aside for the claim, but the actual cost hasn't occurred yet. And so that is why when you look at some of these numbers here, the numbers are kind of hopping up and down, because it also, some of these medical costs from one year to the next is taking into account the actual claims experience for those self-insured plans. And so for the Aetna PPO is a self-insured plan. So we do set money aside for current claims and future claims, but the premiums or the benefit costs that we pay out to both the Aetna HMO as well as the Kaiser are a dollar in and a dollar out.
Chris, Ms. Cortese has her hand up.
Yes, Patty.
Well, if you're going to get to this, then I can wait. But so since all of our medical plans are self-insured, when we talk about rising healthcare costs, does that mean that more people are utilizing the fund, or that the providers who manage these funds for us are charging us more, or what exactly is happening when we talk about healthcare costs increasing?
Okay, sure. I will answer each one of those questions, and I would say also too, we could probably have an entire meeting talking about health benefits, and I'd like to in the future be able to come back and dig a little bit deeper into the details. But to answer your questions, first and foremost, so out of all three of the medical plans, 2 of them are fully funded, 1 of them self-insured, and so the increasing costs of medical, right? The medical costs increase each year. So those are all factored into both types of plans. And so those medical costs go into calculating what are the claims costs, or what would be the projected claims costs. And those translate into how much the actuarials or the underwriters, I would say this, the underwriters look at this and say, okay, based on the trend as far as medical costs, this is how much we project your upcoming future medical costs to be. So we want you to set aside X amount of money to make sure that you cover what the anticipated future medical costs are based on, as you were asking, those ever increasing medical costs. So they factor in, the underwriters factor that into how much they recommend that we set aside for the amount of employees that we have and what has been the claim, what they call the claims experience. So based on the number of employees that we have and based on everyone's medical history, they calculate out what that cost would be. And they translate that cost into what we have to set aside each month in the form of our payment or our premium. Okay, hopefully that answered your question.
Yeah.
Okay, and then just to wrap up, besides medical, we have dental, vision plans, and those are also self-insured plans. So all the money stays in the plan here. And then we do provide benefits, obviously, for all of our active, and we do have benefits for retirees, and we have also self-paid retirees. So the projection for next year, kind of going back to tonight's purpose here, based on our current year's benefit costs of about $36.7 million at the adopted budget, we're projecting next year's increase to be close to 6%. Actually, I think I did mention to the board at one of the last board meetings that we've been sitting down with our benefits consultants, Gallagher, and some of the preliminary numbers for next year's renewal are coming in close to 6%. Actually, I think it came in at almost 7.2%, a little bit higher initially. And I think we just met last week. And so I think they've been negotiating on our behalf to get this number down closer to 6%. So I would be very thankful if we can get it to 6%. If we can't get it down to 6%, obviously this number would have to be raised a little bit here, depending upon where the actual renewals will come in for next year. But right now in the budget, we're just presuming a 6% increase, or about $2.1 million increase.
Chris, Brandon has his hand up.
Yes, Brandon.
Sorry, Chris, just before you move on, again, maybe it's the math teacher in me, I'm sorry, but reading your graph, the numbers that are floating around on the graph, are those the actual values or are those the adopted green bar values?
This here is just the adopted budget values for the green bars only.
So, okay, so for example, so in 2015-16, the graph is around.
Oh, I'm sorry.
million.
Wait. Actually, Brandon, I apologize. I apologize here. These numbers here represents the actual costs. So
Okay.
along the blue line, these numbers here are the actual costs. I didn't have a blue line for the 2021 and the 22 school year. So I put in what was the adopted budget amount. I
Right.
apologize. The graph wasn't intended to be confusing.
Okay, so I got two questions then. What happened in 15-16 that we were only budgeted 33, but we were, up around 37? I don't think you were here at that time, so if you don't have an answer, I understand.
No, I'll go back and look.
And second of all, it looks to me that the blue line is always consistently under the adopted budget. So it'd be fair to say that this 36 million is going to be less and this 37 million is actually going to be less. Is that correct?
Well, I think it's a good assumption to presume, but that's kind of what I was also saying to a little bit earlier on, is that what was originally budgeted was one thing, and then what the actual cost is another, and some of this I would say it's attributed to the self-insure plan, because again, we're setting aside monies to pay for claims, but we were budgeting more expenses to go out. So if the claims didn't materialize, we weren't paying Aetna at the same pace. So I will, this is one of those things, I want to dig into this a little bit more to find out really what explains the differences between what the initial renewal rate and the renewal amount was calculated to be, and what was our actual spend or actual payout. And it really just pertains to the self-insured plan. Because I mentioned for Kaiser, if I budget $1 for Kaiser, it's $1 spent on Kaiser. But for
Correct.
Aetna PPO, a dollar budgeted for the PPO may not be exactly $1 spent.
So you're, just to clarify, you're saying that difference that I'm looking at in the blue line versus the green bar, which is budgeted versus adopted, adopted budgeted green bar versus the actual spent. The only difference is the PPO self-funded plan.
Well, I didn't say it was the only difference. Could be one of the differences, because I don't know what were some of the other budget assumptions back then.
Okay. Thank you.
But I want to look into it. I do want to look into it. But this is good. This is the kind of
Trustee
inquiry I'm
Chavez?
hoping.
Yeah, so quick question. Has COVID impacted the amount of money spent on healthcare? Or like, has there been talk about that? Do districts see like an increase or something we should prep for? Given that we haven't been in a pandemic in a while. So I wonder if that's taken into account as we do these projections.
I know this question did come up with our health benefit committee and the consultants, and if I recall right, I mean, a lot of this is still yet to be known. I think one of the things I think people are probably factoring in is that during this pandemic crisis, a lot of people have delayed or put off certain medical procedures, and so those medical cost claims may not necessarily be reflected in the current today's dollars, but could very well be a lag, and that those costs will probably hit the industry, the following year once everyone feels comfortable going back to the doctors, I suppose.
Okay.
That's a great question.
That's helpful, because I think if that's true, like that's something that we need to take into account as we think about what the future holds. Thank you for that.
Okay. I apologize. I want to try to get us back on pace. I see that it's about 6:20 or so. Let's dive into the other pieces, and I won't spend too much time, but utilities is another big area in our budget. Total combined utilities this last year was $4.5 million. We're projecting this year's to be $5.3 million, and next year to be $5.9 million. We're projecting a 10% increase of about $538,000. I did a quick math calc here. If we were to look at where we were back in 15-16, so 15-16 we were paying a combined $3.7 million in total utility costs. And compared to last year, our utility costs now have increased by 24% since 15-16. So between 15-16 and last year, 19-20, our utility costs have gone up by 24%. And again, don't forget, last year the way we ended last year with a shortened school year, we were able to turn off things. So we weren't having the swimming pools running. We weren't operating our facility, so our utilities costs did drop down just by fact of the COVID environment. And so this year's budget obviously reflects not being in school educating our students, but we're projecting next year's bill or like utility bills to bounce back up to where it was previously to this last 2 years. And so I've just kind of taken the next several slides, and I won't go through each one of them, but broken it down between natural gas, electricity, water, garbage, and sewage. So I'll just kind of go through each one. You can take a quick look. So here's a natural gas, electricity, water, garbage. Interesting point here, if you recall back in 16-17 to 17-18, we switched from providing a portion of the garbage services in-house. We had a sanitation driver position in the district. We own and operate our own garbage truck, and the recommendation was made to switch to a services. And so in 17-18, we contracted with the Conservation Corps to provide those garbage as well as recycling services. And so the big spike in garbage expenses that year were the investments we made with a lot of the recycling bins and everything. But now it's kind of it's now tailed off. But we're anticipating an increase this coming year with our garbage services at a rate of about 10%. Sewer. This 1 year, 17-18, I think that was just probably a budget typo that year. I've talked with staff, and I think it was just something that was, I guess, typed in incorrectly at the time. But that was at second interim. But that's all of the utility costs. Switching over to the next ongoing expenses, property and liability insurance. So property and liability insurance represents insurance for liability as well as property. We belong to a JPA, we belong to Northern California Relief. It's a large pool of school districts. Some contributing factors to our annual increases in insurance. As you well know, we read in the paper every day, public education is dealing with this crisis of sexual abuse and molestation. Those in the last 2 years have really gotten to everyone's attention, especially by now. I'm hopefully everyone is doing everything that they can to address this. But on the insurance market side of it, obviously it's pushed our insurance premiums almost literally through the roof here. And so you'll see that our premium increases for insurance are going up because of things like that. Some of the other things that have impacted public education are these very large jury settlements, just because of the feelings, the personal feelings of juries that want to inflate these litigation settlements. And then we obviously live in both, not just earthquake territory, but now wildfire territory. So our property insurance continues to increase every year because of that, and will continue to increase. And then one interesting fact, just based on our district's own experience, because being part of a JPA means that with the large purchasing power that we have as a JPA, we can obviously purchase insurance at hopefully the lowest rate. But within the JPA structure, depending upon your district's experience, you may be experiencing a higher or a lower rate depending upon what goes on in your district. So in our case, yeah, for any of these civil cases that we have, it's going to further compound our liability insurance. And then, as I was highlighting down here, the fact that our modernization program has been investing quite a bit in our facilities, it has a little bit of an impact on our increased district property value. So, we're over $1 billion here in terms of property values. And so insuring more property means that your insurance goes up. So maybe the closest way to give an example would be, us as homeowners, us that have a home, we insure the value of our home. And as we add on to our home or the value of our home goes up, we certainly want to consider to increase the insurance value of protecting that property. And so therefore our insurance goes up each year. So this has been the trend. Our average increase each year for property and liability insurance over the last 4 years has been about 9.82%. So our projection of 8% is within reason. Moving on, let's get into the last 4 areas, the contributions: special ed, transportation, food services, and maintenance. So let's first focus on special education. So really the focus is on the level of contributions from the general fund. The bar graph, the blue part, the part that is valued here just represents the value of the contribution for special education. So 15-16, the contribution was at a level of 31.6. 18-19, it was 41.1. This current year, it's projected to be 44.4. And so you get the sense in terms of how the bar graph goes. But obviously, the other parts of the graph, we do receive some level of federal funding, some level of state funding, a little bit of local, and there is some monies that we also transfer out. But literally, that's the funding profile for special education. And so some of the obvious contributing factors for our ever-growing contribution is that the fact that both the federal and state government continue to underfund the programs. In the cases where we're not able to provide services ourselves in-house, we're at the mercy of vendors. And so the price of goods and services outside the district, we have to pay whatever those rates are. So I'm referring specifically to like non-public schools, public agencies. Even our county office of education has programs, and they pass their costs on to us. So if the county is willing to give a pay raise, and unfortunately, if we're in a situation where we're not able to do that, they will pass that down to us. So those are some of the contributing factors. And then, as I mentioned, we continue to have difficulty staffing the position. So inevitably, we end up contracting out positions. And I believe we may be contracting out for these services at a rate that's a lot more than if we were able to hire and pay for them ourselves. Obviously, in the world of special education, we have legal settlements that we deal with, and just the normal salary and benefits and our normal operating costs are all contributing factors to the contribution for special education.
Chris, I would just add on that particular slide that 2 things. One, our current director, Sharon Cavallari, was working extremely hard in many areas. One, making sure that we do not get taken to the cleaners when we do have to have settlements. But 2, looking at ways to bring more of our students back that we can actually run the program that's less expensive. But then one of the more promising things, and I doubt this is going to happen in the first few months, and certainly not in time for next year's budget, but our current president is the first president in a long time to pledge to increase the funding for special ed. So hopefully we'll see something like that in the next 18 months, because as you pointed out, this is a federal mandate. It's a moral right obligation that we have to do, but it's a federal mandate, and they only fund us at about 6.5–7%.
This slide here, this is the same thing I was just saying. Here's the tracking of the contribution from adopted budget through the interim reports to the actual year end. And then as we said earlier, with COVID hitting us in 1920, what was projected initially and what was the actual spend at the end of the year represents those savings. So yes, definitely, as the superintendent mentioned, our special ed director last year was able to negotiate some savings to the program because there were services that weren't provided, and we obviously did not end up having to pay for those services last year. But then, obviously moving forward, as those services start to come back online, as we start to if we continue to place students in those placements outside the district, our costs are going to continue to increase. And then for next year purposes, we're projecting our contribution to increase by about 7.5%, or about $2.8 million increase over this current year. And so that is right now the presumption that we're going to go back to what would be close to what we were looking as far as a normal special ed program, and whatever contribution we needed to make from the general fund. So the total is about $47 million. But this is really, has been the trend here. And here's the budget in terms of special ed. Obviously, salary in blue, benefits are in green. So salary and benefits represents the largest portion, and this is our in-house staff. Whereas covers special ed teachers, paraeducators, psychologists, program specialists, all of the whole gamut there. The next largest pieces are the sub-agreements. So these are all those contracts for specialized services, non-public schools, non-public agencies. So those are the large portions. And the other large portion here is the transfer out. These are the costs that go out to pay for county services. So between those 4 bars there represents really the majority of our special ed budget. Moving on to transportation, same theme. There's a contribution that we need to fund, or that we need to provide for transportation. We do get funding from the state. However, I think it's just been an insult that the state has not increased the funding for transportation. As some of you may recall, back when LCFF was implemented in 2005, 2006, the state at that time chose to pull transportation funding out of the LCFF model. So transportation resides outside of Proposition 98 guarantees. And so literally the state froze the funding that they were giving all to education. So in our district, we were receiving at that time $1.5 million to pay for all of our transportation needs. And that rate has been locked in. And since that time, any costs beyond that were on the backs of the general fund. And so you can see here the contribution amount. This is just this number value here is just the contribution level for transportation. So 4.5, 4.9, 4.9, 5.7, 6.2. This last year it dropped because of COVID again. We were actually able to negotiate with Safe Trans at the conclusion of last year. I think we saved about $2 million in transportation costs last year because they stopped transporting our kids once we closed down. And this year, obviously, they're not transporting, I don't believe, any of our students at this time. We're not transporting many of our students. So this year's transportation contribution has obviously decreased, but this remaining portion here still represents our current ongoing costs, and that would represent, our personnel costs, our continued costs to maintain our bus fleet and things like that. And so on this other side here, I just highlighted just some of the facts and figures. We currently have, actually, as of 1920, we had a total of 105 total routes. We have about 40 buses. Out of the 105 routes, 26 of them we do in-house, and we contract out about 79 of them to vendors like Safe Trans. And then these are some of the contributing factors as to the increase. As I mentioned, no COLA on our revenue. We still deal with a shortage of bus drivers. Unfortunately, we're not able to consolidate our bus routes. when you look at the world of transportation, really the only area where you can actually have any impact on your transportation costs is if you have the ability to consolidate routes, meaning operate with the same amount of buses and the same number of drivers, but covering more territory, or covering more routes, or picking up more students. But because the way our district is sized and the way our bell schedules are set up, it's just it's unfortunate right now we don't have the means to consolidate routes. And then one other thing we should, but unfortunately we're not able to. I think it's more contractual, if anything, having our driver FTE positions be better aligned with the actual route times. And so those are some of the things that are just a part of our current contract structure. And then just like with special education, we do have our normal salary and benefit increases on top of that contribute towards the increasing of the transportation contribution.
And
Any
Chris,
questions
just
on
so that
transportation?
for the record, so that we're consistent, the COVID-19 shelter in place really should be over one for 2019 and 20, not 21, 22.
Oh, yeah. Yes. Yeah, sorry.
No, that's
And
okay.
that's
It's just,
fine,
I
we're
just
done.
want the record to reflect that. That's all.
Okay, thank you. All right. Transportation, talked about the increased contribution. So next year, assuming we go back into fully transporting students, and based on the amount of routes that we have, that we contract out and what our costs are, we're projecting next year's increase to be about $3.4 million, which represents about an 83% increase over the current year. So this year's current about 4.1, it's going to grow to 7.5, but that 7.6, but that 7.6 is still on the same path as you see here prior to COVID. So unless we can find some other ways to reduce our transportation costs, that contribution will continue to increase. And then here's just the budget for transportation. Again, personnel costs, and then the largest portion is the contracting out. Okay, next subject, child nutrition services or school lunch program. So our contributions are continuing to increase year after year. If you go back to 15-16, our contribution for CNS was just shy of $83,000. So 83,000 jumping to 672 to 982 to 1.5. The last year 1.8. This year as a first interim 1.3. And I'll explain why it dropped. But next year is projected to go up to 2.5. So let's go back to the current year. The reason why this year's contribution dropped down to a level of $1.3 million compared to last year's $1.8 million. As you recall, the district received learning loss mitigation funds from the state, or LLMF funds. Those one-time funds we use, and one of the areas that we could use it for was to help provide meals and to our students as well. And so we use almost $1 million of our LLMF funds this year to help buy down this year's contribution to food services. So that's the reason why the contribution dropped, because when we adopted the budget, we were estimating almost $2.5 million, but because of that $1 million, we were able to reduce this year's contribution. But that money now will have been spent by the end of this year. And so if everything goes back to the way it was, the contribution back to CNS will be back up to the low of about 2.5, or about a 1.1 increase, or as a percentage of about almost 81% increase compared to this current year. But the next slide, I'll talk about why our contributions have been continuing to increase here. So here's what I think are the contributing factors. Obviously, you look at the bar graphs here. So The blue section here represents the federal monies that we get, or I would refer to as the reimbursable monies that we get from the federal government. So for every meal that we serve, we get reimbursed back a certain dollar amount per meal. But as you can see here, the federal funding has decreased. We've obviously been seeing increases each year as far as the reimbursable rate, but because the amount of meals that we serve has dropped off significantly since 15-16, the drop off in the number of meals obviously has affected the amount of federal reimbursement money that we've been entitled to receive. And the same thing for the state portion, and even to the effect of the local monies that we get are a la carte sales, all of the other things in addition to the school lunch that we serve has seen a drop off in terms of sales. And that is all what I would call participation. So these decreases in the amount of lunches and breakfasts that we serve, as well as a la carte sales, are showing in the form of a reduction in the participation rate.
Chris,
Some other things, yes.
Under the local, does that also include when we provide and they pay for lunches, our charter schools?
Yeah, this includes the monies that we get from the charter schools. This includes all of our sales, and also all of our paid students. So our students that aren't on either the free or reduced program, they are fully paid. They also goes into the local part of this as well.
Yeah.
But one of the main things that's contributing to our increased contribution is that, as I said, we're serving fewer meals, but at the same rate, we've lowered the number of meals, but we've not made any changes as far as our staffing. So there's a ratio called meals per labor hours, and so that number there kind of helps districts manage their budgets, because if we're serving fewer meals for each labor hour that we staff, it's going to translate into higher expenses at the end of the year. And so that is one, I think, the major contributing factors here to our program. And I think we've had that conversation about in the past, is that, you know, we place a particular value on having our program, which is, I think, perfect. I think the high value we place on our food services program is great, but the fact of the matter is that until we can actually serve more meals, it presents the challenge that we have, because having to set more dollars aside to cover our labor costs to produce the amount of meals that we do is really the challenge. Here's the graph on this actual participation rate. So here in the orange bar are the total amount of meals between breakfast, lunch, and supper. So back in 15-16, we were serving almost $1.8 million meals total for the year, and it dropped from 1.8 to 1.7 to 1.5 to 1.4 to 1.3 last year. And again, COVID hit us last year, so we would have seen a decrease here. And then this year here, even with the amount of lunches that we are providing on the curb and our supper program, it's just barely projecting to reach about $1 million. But I did talk with Julie today, and I do agree with her. I mean, if it wasn't for the fact of COVID this last year, I think we were actually starting to see that we might have turned the corner in terms of changing this direction of the decreases in meal participation. I think just with the buzz and the many different exciting meal options that we were offering, that we were actually seeing a higher level of participation. So I told Julie today that, you know what, once we return back to regular school, I'm hoping that maybe the kids at home would be a little bit tired of eating at home and would be looking forward to coming back to a different lunch. And then especially now because of the limited choices that we serve on the curb. And if once we go back to serving meals on site, there'll be more choices for students. I think that I know that these numbers are gonna start creeping back up, but we definitely still need to be cognizant of this decline, because if these numbers continue to decline and our meal per labor hours don't change, it's going to further continue to increase that contribution to special education. I mean, to food services here, where it will go over $2 million a year in no time. And then here's the budget for food services. Salary, benefits, obviously the largest portion, and then obviously supplies, food costs. Okay, last area, and then we're almost done. Routine repair or our maintenance program. If people aren't aware, there is a education code requirement that we have to set aside 3% of our budget from the general fund. And the only reason why we have to do it is because it's a condition of accepting state construction funding, bond money to build schools, or bond money, state bond money to modernize our schools. By accepting those state funds, obviously the state wants you to set aside money to maintain your facility. So that's really the rationale behind having to set aside 3%. Just recently, the governor and the legislature allowed some exclusions for some of the things that go into calculating the 3% reserve, the 3% general fund set aside. So like this year with all this COVID money that we're getting, all this one-time money is great, but having to set aside 3% of our general fund on those dollars made no sense. So they created some exclusions to that list. But then the contributing factors, like with special education, just we're at the mercy of vendors in terms of what they charge. And then but this contribution amount is going to ebb and flow. As the size of our general fund budget increases, this will increase. As our budget shrinks, this contribution will also adjust based on the size of the general fund budget. So the projected contribution for routine repair next year, based on 3% of our general fund budget minus those exclusions, is estimated to be about $9.1 million, roughly about a 13% increase compared to the current year. And here's the budget: staffing, personnel costs, and supplies, basically the same. And then finally, here's the recap. So we started off with, what were those major ongoing expenses that we needed to highlight for next year's budget. So this second column here are those numbers that I initially shared with everybody. Next year's funding based on the 3.84% projected COLA, as we said earlier, and based on our projected ADA, next year's new money is about $8 million. But those $8 million, I have said and will continue to say, a lot of it is already spoken for. So when we go down the list of the things we talked about tonight, from annual changes with the salary schedule placements, step and column, or the STRS and the PERS increases, the rate increases, health benefit increases, utilities, property liability insurance, and those contributions to those 4 programs that I talked about. This represents, this column here is meant to represent next year's cost increases to the budget. So all of these things added up totaled roughly about $15.1 million of projected cost. Now tonight, as I went through each one of them more specifically, some of them remain the same, some of them I adjusted based on just some of the deeper dive looks into it. I've now adjusted this total here for some of them. The new total is $16.2 million compared to $15 million, a difference of about $1.1 million. And then these are the four areas, three or four, one, two, three areas that changed. Step and column, STRS, PERS, and then utilities, four areas that changed. All the other areas as of now, tonight, I didn't make any changes to these assumptions. And then as board member Herrera mentioned earlier on, these numbers that we talk about tonight, they're going to change. All these numbers are going to be changing between now and when we adopt the budget in June. But this kind of just hopefully gives everyone a current snapshot picture in terms of what are our projected ongoing cost increases to next year's budget, given the fact that we do and are anticipating some amount of new money for next year. And it leaves us right now a deficit of about almost $8.2 million. And that's not to say we are still currently dealing with a current deficit, not taking this into account quite yet. And then, so I'm just going to wrap up with, again, what we are looking at for our multi-year. We've talked about identifying about $6.5 million of reductions. Doesn't necessarily translate into personnel, but we need to find $6.5 million reductions going into the 22-23 school year. The 22-23 school year. So we still have one more year to address this, but the looming issue will be is if we don't start addressing the structural deficit, the deficit will be projected to be about 25 million starting the 23-24 school year.
Chris,
and this is just a multi-year. Yeah.
Chris, a quick question then, if you go back to the one slide. And I should know this answer, but I think I'm just hungry. When we say we have a deficit of 6.5, does this take into account the previous slide that shows based on projected new revenues from the COLA and projected expenditures that we have a structural deficit just in a single year of 7 million? Is this 6.5 take that into account, or is that added to the 6.5?
No, good question. This 6.5 is taking into account already the projected 3.84% COLA and projecting those expenses. So this is already factoring that in.
Great. So if anything, if you go back 2 slides, then if anything is added to any of these beyond what we projected, then that 6.5 number will change.
Yes, up or down, right? Anything positive or anything
absolutely
negative will change that number. Okay, all right. So we're at that point. Hopefully we have enough time here for comments and discussion.
Just a brief comment. I want to, I just appreciate very much how well organized this was and clear and not difficult to understand. I appreciate the framework. And I'm also realizing that when I made my comment about the ever-changing numbers and a degree of fluidity and sometimes volatility, I meant that less to be about projected expenditures and more to be about projected revenues, at any given point in time, because that's what tends to, put us in situations of a dilemma on a 3-year budget. And then as time goes on and more revenue information develops, so far we have a history of things turning for the better and, not as catastrophic as seem to be at one given point with a 3-year projection. So the numbers will change more on the revenue side in my experience. And here we are because we have to comply with the state's requirement at any point in time to balance the budget on a 3-year projection with the revenue information we have at that point in time. And that's just the systemic and structural dilemma we're always in. So good
Thank you for that
presentation, Mr.
clarification.
Ju. Thank you.
Any other board member has any comment? How about our stakeholder? We all clear every questions, and I also appreciate Chris Chu and his staff have been really work very hard to put the presentation out. I do have one question about utility increase. Chris Chu, I remember that I think during the time that Mr. Former board member Frank Bill was here, we did have the solar, I think, program that we be able to help, observe for the program that we can reduce some of the costs for utility. I don't remember that is the correct number during that time. Superintendent Fung, did you remember?
The
For
amount of savings?
Yes, the amount saving would be,
Wow.
changed.
I would hate to throw out a number. I don't remember, Madam President.
President Lay and Superintendent Funk, actually, it's a great question to ask because I just recently had a meeting with our solar panel consultant that helped put in the solar panels, and I've asked them to plan to present to the board at one of our upcoming board meetings an update on where we are with our program, how much energy we have produced, how much we've saved. And so I think it's a great question and a very timely question to bring up. But I would add this, when you go back and look at, hopefully everyone can still see the utility slide here, where my arrow is. I would like to actually go back and again, see where our utilities were even before this, because if my recollection is correct, I think we brought the solar panels in probably in the, 2003, 2004 timeframe, early 2000s.
Right.
And since that time, we should certainly have seen significant reductions, or at least not having to buy electricity from PG&E, but being able to produce it. But I'd be kind of curious to see what our actual consumption has been, because generating power and buying power, whether we're generating our own power or buying power from PG&E is one thing, but I would be really interested in seeing what our actual consumption has been. I'm going to presume that maybe our consumption has increased by some magnitude over this time. I know we have been modernizing our facilities and replacing equipment when we can. And so there's certainly been energy efficiencies with a lot of those things, but I would venture to say, based on a district our size, I believe probably our consumption, and it's not just electricity, but it's water too. It's water, garbage. Our consumption has increased over the years. And depending upon, again, how many students that we have, how many facilities are we operating, I think over time, those are all contributing factors. But I do wonder if this rate increase that we've seen really is all reflective in the rate increase. So each year PG&E wants to charge a higher rate, but I'm curious as to whether or not the full cost increase is all contributed to the rate, or is it partly being impacted by the level of consumption?
Yeah, please do, Chris Chu. How about other stakeholders? Does anyone have any question and comments? I'm sure it's a lot of information that finance department has been worked and look back to 5 years trend. So I think that's is a lot of question that probably we probably will not absorb everything for tonight. But, you know, we'll open up to see, how about student?
I see
representative?
trustee Doe's hand is up.
All right, go ahead, board member Joe.
First, thank you. I want to thank Chris Hughes and staff for putting this presentation together. I know it's an enormous amount of work. And even though this is not my first time listening to this presentation and variation of it, I feel that I'm still continuing to learn and take out and learn from this particular presentations even more than the previous one. So thank you. I do want to have a side comment. I don't know whether the ratio about utility costs make logical sense or not because of what PG&E is doing. But do we have a competing alternative options, or that is not viable for academic institutions like ours?
That's a very good question. I don't think I have the answer. What I am aware of, I believe that within the city of San Jose, I think there was maybe an option that school districts could purchase from an alternative. We actually do buy our natural gas from a co-op. So we belong to Spur. It's another JPA organization for school districts and other governmental agencies that purchase natural gas from a larger pool. So we do for some of the utilities, but I'm not 100% certain right now if we have the ability to purchase electricity from alternative sources at this time. We're just kind of stuck with maybe PG&E for electricity, other than producing power on our own.
How will we proceed if we want to look at the alternative options? I'm not saying we should do it or not. I'm just saying just to examine other or review other potential options. How will we even take that steps?
Well, I mean, we can certainly do some research, and then ultimately, if there are some opportunities out there, we would probably just go the route of sending out a request for proposals to get vendors to propose whatever alternatives there are, and we would then evaluate it and do our due diligence and make some informed decisions based on what would be to the benefit of the district. So that would be the normal process. So if the board would like us to look at some of those, we certainly can look into it and come back with some information to share with the board, just for information, maybe in just a Friday update.
If there's no violations of the Brown Act for me bring that, suggesting that at this point, I love to have that as at least from an understanding perspective for futures board meeting.
Yeah, it's tied to the current presentation topic, so that's fine.
Thank you. And thank you for entertaining my questions, Chris. Appreciate that.
Madam President, I know there might be other comments, but let me just, for the sake of making sure my notes are correct, I believe, and please anyone correct me if I'm wrong, there are 3 specific follow-ups on top of the one that President Doe just asked. One was to respond to Jack about getting the actual step increase for 2021, the current year. The second was to the one that you're currently working on to support Thomas's request about looking at the total salaries minus retirees minus salary increases. And then the third from Brandon was for us to just do a little deeper dive in 1 or 2 of those years around the health benefits and why the cost shot up or we are under what the projected costs were. Are there any other follow-ups that, are those 3, did I say that right? And then are there any other ones that I might have missed?
For mine, the retirees weren't needed. I actually just emailed Chris Jew, just a side email, just pointing out the 3 little data points that would be needed. And he can, I know he's busy, so he can always forward those to me. I can help calculate and send them back, and we can talk about it.
Perfect. Thanks, Thomas.
Yep.
My question is fine. You got it right, Chris.
Thank you.
Any other stakeholder? about CSEA or AFT. Any comments and also board student representative?
Parent or parent representative?
Parents representative or stakeholder? Seems that's very quiet, and I'm sure that we bombard with a lot of information. I know it's like it's gonna have to take time for people to absorb all of this information, and I really appreciate you know, the time that all stakeholder as the CSEA AFT leaders as well as parents and students that took time to join us today for a study board session on budget during this winter break. So that's is really something that are really common, you know, that take a lot of time and you know, and commitment to do that.
I see a couple of hands up, Madam President. First, let me just welcome and introduce CSEA President Julio Pardo. We did introductions, Julio, at the start, so thank you for joining us. Brenda, I see your hand up, and then Patty.
Yes, please.
Thank you. I know that we have done work with this committee before about identifying possible ways in which we can reduce expenditures. Is that where our next step would be after we have reviewed this information?
Well, we certainly know that we want to continue to track and figure out ways to reduce the number of contributions to CNS and certainly to special ed. So those two are things that we're going to have to continually track as we move forward. And then transportation potentially.
Well, I was thinking of the list that we had created quite a while back about possibilities when we were looking at things that we might have control over. Of course, with COVID, that's a whole different issue. But that's what I was referring to. It was a while back.
Oh, I'm sorry. I think that this group and the BAC will continue with those conversations as we move forward. But if you recall, the urgency of submitting a detailed plan to the county by January 30th was removed because of the amount of federal stimulus dollars and the proposed governor's COLA. So that 6.5 million is now pushed out an extra year. So we have between now and next March, if nothing else changes, to have those conversations.
Thank you.
Thank you, Brenda. Yes, is that Patty or any other?
Yeah.
Sorry, Patty, go ahead, please.
Thank you. I just want to acknowledge that Nada Ahmed from Californians for Justice is on the line, is on the meeting as a participant, and I just appreciate Californians for Justice has been a great partner for us, you know, especially weighing in on these big budget decisions. So thank you, Nada, for being here.
Yeah, thank you, Patty. Any other hands that I did not see on the screen? So if I don't see any other hands, so this is the first board study session on the budget, and I want to know that does anyone still have some other question? We're going to go to looking for a second board study session after the budget revise or something like that, right, Chris Funk?
Well, the next time we come to the board is for the second interim, and that will be in March. And so between March and the May revise, I'm sure there'll be more questions. So that might be an appropriate time to think about another focus group, but I don't think we need to set that date tonight.
All right. I agree with you. So we do want to wait after the second interim, then we look for another day to schedule a board study session to iron out all of those details before our budget time. So I did not hear from Julio. Julio, do you have any comments? No?
No, Julio Pardo, CSCA.
Yes.
No, a lot of this stuff, you know, we've reviewed in the past. It's just that the appreciate district putting more detail. I will say that there are some questions I do have, but I don't want to really go into it right now. I will send those questions to the board and to Chris Jew based on things I have brought up in the past regarding some savings that supposedly were taking place, which CSCA was supposed to get reports on, which we never did over the past 2-3 years. And also on savings that CSA helped generate by agreeing with the district to freeze some positions a couple of years ago. And the fact that the numbers of employees of CSCA has been so drastically reduced since 2008. And so those questions I will bring up at another time.
Right. Thank you, Mr. Pardo. Any other stakeholders? Christopher, I know that we talk about the last several budget study session. I don't know that, yes, a lot of people probably will not remember, you know, during the time. Is there any way can we summarize it, you know, from the previous board study session when we bring it back in maybe between April or May before, you know, the final budget, so we can analyze which item that we already talked about it and have not solved it, and which one that we continue to make the improvement. Does that make sense?
Yep.
For a request?
Absolutely.
Okay, so if no one has any other question, then should we be adjourned before 7:30? But we still have until 7:30. I'm still gonna be here until 7:30, but I just want to know that anyone that have any other question, if we did not touch on, or we probably gonna revisit it, you know, the next board study session between March and May.
Time to adjourn.
Okay, all right. Now I'm gonna adjourn the meeting and look forward to see all my board colleagues on Saturday for board retreat.